But one of the things she mentioned in her review was, I smelled Chinese food and the girls were all eating and talking. When you go into the medical doctor's office or whatever and it smells like that.
Yeah, if it smells like chicken vindaloo, I don't know if I want to,
right,
get my
which I love, but not
exposing bond done. Hey everybody, got a surprise guest today. Actually, two surprise guests. We have my cat, Emic. Let me get him off the screen here. And we have Dr. Joe Doctora from outside of Nashville, right?
That's right.
And you are oral surgeon, right?
Oral surgeon, trained here in Nashville, and after training, stayed. So I've been here for 20 years.
Did you grow up in Nashville or outside or in that area?
I grew up in Detroit.
Oh, nice.
And basically was born and raised there.
Like 8 Mile? No?
22.
Other side of the tracks?
Right. Close enough. It's a good city, and I have nothing negative to say. I love Detroit.
So we are talking about reviews today, right? Like people who write reviews on your services, your office, your staff, you. I actually just attended a lecture last week actually, and it wasn't necessarily on reviews, but it was on marketing, and they talked about reviews and how to respond to reviews, and it's so difficult. When you get a bad review, like how to even respond to that without, getting a bunch of patient information out, that kind of stuff. How do you deal with bad reviews?
A lot of people will look at the reviews first. I ask patients for them. And I've got a lot, so I'm very proud of that.
How do you ask them? Do you say, hey, do you want to write a review? Or do you have a QR code hologram when they walk in? Like, what's going on?
I'll ask them. I'll just literally text them. And I'll say, hey, this is Dr. Joe. You had surgery last week. How's it going? So I really reach out to pretty much every single one of them and ask them how they're doing. And it's been effective for me.
And how long you been doing it that way?
Years, probably at least 5-6 years, and a lot of times people will write them on their own, but for sure I'll ask for them and just really see how they're doing post-operatively, and patients really appreciate that. That's really something I've done since I finished training, is call the patients the night of surgery.
Yeah, we do that too.
And I'll go a step further and follow up like the following week.
Good to know. So in doing that, have you noticed a trend in your reviews at all, like online?
Yeah. I have a lot of them, so I think that's I've got almost 900 between my two offices.
Ridiculous. I've been in practice 17 years. I don't think our practice has like more than 100 reviews. Like, I don't know. Yeah. It's just we don't do it right. We don't really it's just what it is. It's just, hey, you want to do it, do it. That's kind of how we feel about it. The downside of that is, the average rating is not great, I think, and so and also it's just it's sparse. Like the last review is like a year ago. The last review from that is like 17 months ago. When people look at your reviews, it's like there's not a ton of recent stuff that people can see, which I don't think that's good either. If you're continually getting these reviews and like the last one was like 3 weeks ago or something, I think that says a lot.
Yeah, I went to a course similar to the one you went to. Actually, it was at the last AMOS meeting, the last one I went to it. In fact, they talked about that, and they said that kind of the sweet spot for credibility with reviews is around the 4.7, 4.8 range. And then it's good to have, to your point, reviews that are recent, because they even say stuff that's more than a month old doesn't really, I guess it
Yeah, I look at reviews sometimes when I'm looking for a place to eat, and then I'm like, that review was like 7 months ago. You're right. I don't really weight it the same as someone said, oh, is there, 2 weeks ago? I was like, oh, okay, what's going on?
Right.
What's happening? So that does make sense. Are most of your reviews on Google then, I presume?
Yeah.
So that's like over 90% of reviews are on Google now. And
right.
So when this lecture I went to, they kind of broke it down, and your most bang for your buck to do anything is to get a Google review. And because they tie those reviews with their Google Maps, with their search SEO and everything. So you're going to come up in the first, like when you Google something, let's just say Google oral surgeons in Nashville. Dr. Joe is probably going to come up to the top. That's you, right? Because of your strong reviews. And then, so you're going to also be listed in the maps. Like they usually list 3 offices in the maps, and you're probably going to be up there. And so they're using all this data to, formulate how to place you. And with your review component that high, that's going to kick you to the top in a lot of searches. Just a generic search, dental implants, Nashville, dental, whatever people are searching for, your name is probably going to jump to the top. And that's kind of how you have to think about it, right?
We were a referral-based type business practice. And, you could be A list on some general dental offices. You may be B, you may be C, you may not be on there at all.
Yeah.
So this just adds one more layer of an opportunity for patients to find you, because, my experience is a lot of patients are driving longer to see me based on my reviews.
Yeah.
And I think that's very helpful. And, if you're young in practice and you've got that energy where you want to take dentists to lunch every week,
which I don't think really works, by the way. Yeah.
We can have a whole nother show on that. Exactly. I mean, sometimes I've seen the opposite effect. Like they meet me and they quit. It's like, well, I'm not sure what happened there.
I thought you'd be big, more buff because you work out all the time.
Exactly. So, we had to be the other way. And I think now it's because everybody does their own research. And I think that it helps to have an online review. So, you have to put effort towards it, in my opinion.
So 900 plus reviews and counting. I can't even imagine what that looks like. Because if I ever see that on something, sometimes I'm thinking, how do they get those freaking that many legit reviews? Because if you look at the people that review, it's not like bots or anything. There's actual people there.
Right.
So that's part of it. And because Google does a pretty good job of hiding people now, I think, that are fake. So I trust Google more than other ones. So over 90% of reviews now are on Google. Yelp is 3%. I just used to remember Yelp being the biggest thing. But in reality, it doesn't work with Google, and most people are Googling. They're going to put a search term into Google.
Yelp, I have, I think, 7 reviews. I never really made that a focus, but Facebook,
I'm a big Angie's List guy.
I just never went there.
Yeah, I know. Health grades for doctors is, considered also pretty good. So health grades and Google is it.
I think Facebook and Vitals is, Vitals not so much, but Facebook. Vitals used to be maybe early 2000s, but I would say it's really Facebook and Google.
What's funny is when Google's getting their reviews and stuff, they're using Google data. When Microsoft or something does their Bing reviews, which nobody really uses Bing. I don't know who uses Bing, but they go off Facebook reviews or Yelp and stuff. It's just weird. It's just the way that reviews are broken down is crazy. I mean, who really trusts Facebook reviews? I don't trust anything on Facebook really.
Yeah.
But
right.
But everything counts because Facebook's big in people's communities with parents because they're older. They use Facebook, right?
Yeah.
But it's really, Facebook is getting weeded out, I think, with everything.
Yeah. So part of my thinking there is, say somebody does have a not positive experience at your office. If they're going to vent, it's going to be on Facebook. So I think it would be good to have a layer of positive reviews there, even though maybe it's not as big as Google. And I've made that a point of emphasis as well.
I've been performing full arch dental implant surgery since 2012. I started back then with Nobel implants, and I continue to use them today. Getting consistent results over time and seeing these restorations in function over that length of time has basically strengthened my use of the product. There's over 100 implant systems out there. I just choose the one that's been the most consistent for me.
So what are the people saying in your reviews? What do they say? What are the good ones? What are the bad ones? Is there a trend? Do you guys fix stuff? Talk about the reviews? What do you guys do?
I think how you respond to some of the 1-star reviews, and I've got quite a few 1-star reviews as well. I've got a 4.9. Yeah, I've got a 4.9 average, but there's really no medium. There's no middle ground for me. It's either 5 or 1.
Right.
So, I mean,
you can't please everyone. I mean, that's just life. You can't. Someone's going to not like you the first 3 seconds sometimes. What are you going to do?
Oh, I've seen that. I've seen, other businesses. I can feel their energy, that they're frustrated, they didn't deserve it. And that's common. And
you mean when they respond to their bad reviews?
Right. Yeah. Right. And then they get a little defensive. And first of all, as you said, we're not in a position to even discuss procedures for
that's
violations.
The problem. You can't really say much.
Yeah, they can say whatever they want about the procedure, and we can't really comment on that. I just say, the way I've handled it is I've just generally been contrite. I've owned it, kind of said my side of the story, and kind of let them vent. But you definitely want to address it. You don't want the person reading the 1-star review to have that be the last word. So you want to kind of come over top with them at a different level of, we apologize for whatever bad experience you had. We feel like X, Y, and Z. I kind of break down the experience in my office to 3 phases. Okay. So, and I tell this to my staff. You've got the pre-surgical phase, which is the phone call to make the appointment. You've got the going to the front desk to fill out the paperwork, and then the consultation. And then the second phase, and this is all just me, is the surgery. How that goes, and that's my department. And then the third phase also is my department, and the front desk department is the follow-up. So, did the right prescription get called in? Did it even get called in? Did we call them? Did we return their calls? Whatever. So, I coach my staff and say, oh, we may have dropped the ball at the first phase. They didn't like the tone of the phone call, but then we finished strong, right? Or the first two phases went well. The surgery went well. The wisdom teeth are out. Kind of tell the patient, we did 2 out of 3. We'll try to do better on whatever. And if you tell patients that, they're pretty receptive. Most patients I've come to learn are pretty reasonable. As much as I want to think that the general public is not reasonable, I think for the most part, people are reasonable. That's kind of my take on things.
So do you got some bad reviews you can share with us?
Yeah, I'm happy to. I think we talked about that.
I think everyone's dying to know.
And I just want to start by saying I don't refute these reviews. I own them. I don't debate them. I'm not disparaging the writer of the reviews. This is their experience, man, and
yeah, and this is what we use to make our office run better. Like, we use these bad reviews and we talk about them at our meetings too. It's just
you do right completely. So let me go ahead and Google myself here. All right. Okay. Here's one. And I just got this 2 weeks ago. I'm quite surprised to see this dental office with a 4.9 review. Only one complaint here makes me wonder. I do not see my experience to be an isolated incident and the only one who has been treated so unkind for no reason at all. My experience was absolutely horrible. Mr. Doctora was far from nice, and he was downright rude and treated me disrespectfully. He made me feel like my issues with my teeth were my fault, and his body language screamed that he could not wait to get out of the room after only spending 10 minutes with me. I had multiple mandibular fractures and several loose and missing teeth knocked out from an accident that was in April of 2024. Mr. Doctora's lack of empathy, rude responses, and charging me $80 for doing absolutely nothing for me but providing me with a horrible experience is very concerning. This man will never touch my mouth, much less perform a surgery on me. Yeah, so keep in mind, this was written 2 weeks ago, and I did the consultation in October. So here's how we responded. We can go into the science of, mandibular fracture 6 months later, that sort of thing. Here's how we responded again. All right. I said, Tiffany, you are right. You consulted with us in October. We do charge for that. I don't recall it being a bad interaction because that was 5 months ago, but I'll take your word for it. If so, I assure you it wasn't you. It was probably me. Best of luck finding a provider that's a better fit.
I mean, that's simple, and it's not, beating around the bush or anything. It's just, it is what it is.
I think a reasonable person looking for an oral surgeon will kind of see that was really kind of a rant. You know what I'm saying? And keep in mind that this was written after our collections made phone calls for.
Yeah. Sometimes that's a trigger for these things. That's a trigger for these things. Yeah.
And you know what I think that doesn't make this a bad 1-star review is the fact that, we didn't do the surgery on her. Right.
And you didn't treat the patient.
Didn't treat the patient. The review was written 5 months after, and the supposed mandible fractures were like a year prior.
Right.
So, anyways, that's kind of respond kindly, really.
Mm-hmm.
You know what I'm saying?
Kill him with kindness, Joe.
Pretty much. Your first reaction is rage, obviously, but then that won't get you anywhere. That's not at all. One of my reviews, it was also a rant about how, and she was a repeat patient, but one of the things she mentioned in her review was, I smelled Chinese food or just whatever kind of food, and the girls were all eating and talking. I'm not going to dispute that. I apologize for that. And I said, yeah, we could have done better on that for sure. But you definitely want to always respond for sure. But yeah, to answer your question, some of the trends would be like things we learned from, like, no one picked up the phone. I called 4 times and I got the voicemail. So those are things we all can learn from for sure.
Yeah. No, that makes sense. We've had issues before with, people warming up something really stinky in the microwave. And I've actually banned there's these dumplings from Costco, I guess. I don't know. Someone was warming them up once and it smelled from the back area to the front. It smelled so bad. I'm like, I literally had to like make an executive order that says, no, we're not buying these from Costco anymore. They smell so bad. It's not worth it.
Right.
Kind of like tuna, but worse. It was just bad.
Yeah.
But yeah, so that makes
Yeah,
sense.
you know,
You don't
and
want
you know,
that.
put yourself in your situation. You go into the medical doctor's office or whatever, and it smells like that. Yeah,
Yeah, if it
I
smells
get
like
that.
chicken vindaloo, I don't know if I want to, get
Right.
my
Which I love, but not the
exposing
dental
bond
office.
done. But yeah, that's fine. But yeah, so any more bad ones? I mean, so like it's just
Yeah, sure. I mean, I just think for your audience, you can maybe learn from. I mean, just see how things that work for me are okay, and it may fit for your practice as well. Let me see here.
And are you the one handling all your reviews personally then? Or do you
Yeah,
have someone that helps out? Because
no,
that's a lot of work.
it is a lot of work, but I dedicate really 1 day a week to it.
Oh my God.
Hold
Good
on.
for you.
Okay, this is kind of typical. This is from a year ago. This place is nice at first until you start to ask questions about billing. They decided to bill my insurance for a procedure with incorrect billing codes to be paid over $2,000. They knew the insurance would not cover the procedure and waited weeks to inform me. After being informed, they gave me the runaround on why they would not resubmit with correct coding to the insurance. I was told by insurance that they should be submitting a different code so that it would be approved. Beware and make sure you are understanding that you are being billed for and or expected to pay. The office manager does not ever want to talk about you when you ask either. The overall experience was a nightmare. I would not recommend it. I would give it a 0 rating if I could. So that was nice. And another billing issue.
Yeah, I know. And every office in America is going to get billing reviews that are bad. The thing is I'm not a biller. I do surgery. I know that stuff. To be honest with you, I don't know the ins and outs of billing as well as people that, that work in the office that do this all the time. And so I don't definitely defer a lot to them. And a lot of but I do know that when we're going over treatment plans with patients and insurance coverages and all these things, and a lot of these are estimates. And so we can't know for sure at the time of the procedure exactly 100%. We're doing our best from what we know and what the patients are telling us and what we can get from the insurance company. Is that right?
100%. And
Yeah.
if potential patient reads that, they may be looking for a practice because that happened to them at another practice. So if you look at other practices in your area, I'm sure they vent to you about what happened to them at another practice. So I think it's across the board with misunderstanding about insurance. And a lot of times you're the first place they went to and they have to learn it at the second or third place they went to because my office manager has 22 years experience. She knows what she's doing.
And they don't sometimes they'll come in and go, not realize all their benefits have been taken up with other procedures. And then this is not going to be,
right,
covered as much.
Here's how I responded. I said, our practice submits codes every day to be reviewed by insurance companies. We are credentialed with most of them and we are familiar with their process. It is not uncommon for opinions to be different on codes. This is why we always submit them beforehand to avoid any confusion after. Our practice will only bill after the procedure is performed. So what was submitted was a predetermination.
Right.
Yeah, sometimes insurance companies will respond and request to resubmit a different code. Sometimes we will agree with them, sometimes we won't. Again, that is why it is all ironed out on the front end to avoid any confusion after the procedure has been completed. I've been there. That's a nightmare. We're happy your initial visit with us was nice. Best of luck finding a surgeon that's a better fit. So, again, I didn't do surgery on the guy, and it was a misunderstanding on money.
Yeah. No, I mean, that makes sense and stuff. We get a lot of those too. It's just like the billing, this, and that. I totally get that. Things are expensive. We're doing our best. We're not doing this on purpose to screw people over. It's literally like we're trying to do our best to make sure we figure out the costs is going to be. And you're right. We figure this out kind of before the procedure, and sometimes things change during the procedure. We realize we needed to do something different, whatever the reason. And so things happen that way too.
Yeah, and patients will find out what their out-of-pocket is from their EOB, and then they'll take it out on you. It's like, well,
and we're, but the other thing is, and we don't talk about this, I don't think often enough. Like if I'm, a patient comes in, we book them for like an hour wisdom tooth, surgery with sedation. If I spend, 40 minutes taking those teeth out, that patient's going to get a 15-minute refund for anesthesia. And so like we're giving off refunds for time not used. Like they're couple weeks, all of us take turns signing checks with our bookkeeper to give all the refunds back to patients for stuff that we did. We estimated this and we got everything reimbursed and like, oh, the patient is owed back this much money, and we're doing that. We're literally just sending it all back. Like that's how.
And I like to talk about that at the consultation, because patients will sometimes ask me, well, how much is this going to cost? I said, well, I put the codes in the computer, and our office manager is going to circle back around and give you an estimate. And most patients are good with that. Some patients want to know to the penny, what it's going to be.
Yeah.
And I say,
that's
well,
fine.
if you get it done today, it's an estimate. And they kind of have this look of suspicion. And I'll say, well, just like you said, I said, every month we send out statements and refund checks. So, we'll get it right, but you'll get your EOB and you'll know exactly. And sometimes if that's not good enough, I'll say, look, if you're not comfortable with that, wait for your EOB, and then you'll know to the penny what I'm going to submit and what's going to be your bill or whatever. And sometimes they'll take me up on it. But a lot of times patients just want to get it done, and we'll send them the refund check or the statement after the fact.
Yeah. So yeah, the refunds are huge, and I don't think that's talked about enough. That's definitely a thing that, it's sucks to see money leave the office, but that's if I didn't do that, I'm not charging them for that. Same case of replacing an implant and they're consented for a bone graft and this and that. We end up not having to do a bone graft. They're going to get a refund back for that bone graft they didn't get done. They didn't need, really. So that's all part of it too, just being efficient that way. So that makes sense. When you send patients your link for reviews, like when you call them, are you just sending them like a Google link, or how do you doing this?
So I'll give them a link at the office, but when I text them on the phone, I'll just coach them. Meaning I'll say, Google Dr. Joe Doctora Smyrna, and my other office is in Spring Hill. Yeah. And they'll just kind of do it on their own.
Okay.
But yeah, it's pretty easy. And most people, I used to ask patients if they had a Gmail account. Most patients have it now. So
yeah, I still got a Hotmail, but I have a Gmail too.
Right.
But you know what you're doing? You're doing like two things with that. If you really think about it. So if you're saying, hey, just Google me, when people Google you, like just say they're Googling Dr. Wahan, they type in Dr. Wahan, however they want to spell it. Google remembers that, like how many people Googled you. And so that's also something that they use in their ranking system. How many times you've been Googled. So if patients are actually trying to Google you, you're also going to get ranked higher because people are trying to Google you. And then they're going to end up writing a review, and that's another thing that strengthens it. So what you're that's actually a multi-layered, if you think about it, how it works. Smart way, because if you're just sending a link, they're just clicking a link. They're not Googling you. So they don't use that. Google doesn't, use the people typing your name in. So, if you really think about it and break it down, that's a couple different things that they're doing to strengthen that person's, rankings and so forth. So just put it out there.
And they can see all the other good reviews. I think they'd be more inclined to do it. Because there's practices that are around my area, and I know they're battling bad reviews. And, it's like a snowball effect, man. If you get 4 or 5 bad reviews, then it's people are going to pile on, and I've seen it. And it's just kind of like digging yourself out of a hole. Luckily I've got a lot of good ones, and going back really 10 years, I think that gives me a lot of credibility. Yeah. But yeah, it's important, I think, if you're especially starting out in business today.
Yeah. And like I said before in the beginning, Google is the biggest one because it links to their maps. It links to everything that people use. And it's like 90% in the US is Google's market share for that kind of stuff. So that's awesome. But yeah, this has been really good, Joe. Thanks for coming out. I really appreciate it.
My pleasure.
Seems to enjoy it.
Right.
All right. Take care, my man.
All right. I appreciate it, sir. We have a good Sunday.
All right. You too.
All right.
Later.
Talk to you later.